Hi, my name is Allison. I'm going to be your student nurse for today, and I'm going to start your intermittent infusion, your intermittent feeding through your NG tube. First, can I verify your name and your date of birth?
Yes, Jane Doe, September 7th, 1950.
And do you have any allergies, Jane?
No.
Okay. So I already performed my pre-assessments. When I came into the room, I washed my hands, I donned clean procedural gloves, I closed the curtain for privacy, I assessed the environment to make sure it's safe, I raised the bed to working height, I raised my patient's head of the bed to at least 30 degrees, and I did my pre-assessments of the lungs, the bowel system, and the exit site of the tube. I also aspirated and assessed the consistency and the color of the aspiration, and I decided it was safe to administer this feeding today. So I gathered my supplies, I verified my order for the type of formula that we're going to be administering today, the amount, the rate, and I made sure I have the right patient, the right type of formula, I'm administering it at the right time. I checked to make sure that my formula is not expired. So I have the right patient, right time, right formula. I have the right rate and the right amount. So first, I'm going to hang my bag, my feeding administration bag, and be careful not to contaminate the end of the bag that will be connecting to the patient's tube. I want to put a label on my bag that has the time that we're starting the feeding, the rate of the feeding, the amount of feeding, the date, and the type of formula, as well as my initials on there. And I recently have flushed her tube with some tap water and confirmed patency and that there's no occlusions. So now I don't have to flush again. So now I'm going to close my roller clamp on here on the administration so that I can prime my tubing. Make sure to shake the formula and pour the prescribed amount into the bag. Squeeze your drip chamber to fill it halfway full. Now I'm gonna slowly open the roller clamp about halfway and watch the tubing fill with the formula all the way through without any bubbles, and just let it drip into a separate container all the way to the end. After it drips out one time, you can close it. Now, after priming, if I'm using a infusion pump, I would want to place the administration set in the pump and press pause, make sure that nothing is running yet. Now I want to come over to my patient and make sure I trace the feeding bag with the tubing to my patient to her feeding tube to make sure that there is no misconnections. So now I can attach the distal end of the administration tubing to the proximal end of my patient's feeding tube. And once that's secure, I can unclamp my tubing and program my infusion pump to the correct rate, and then let it run. Now, if I was not using an infusion pump, if I was administering the feeding by gravity, I would have to, instead of programming the pump to the correct rate, I would instead, after connecting it to the patient, I would unclamp my roller clamp and then count the drips in my drip chamber for 15 seconds and multiply by 4 and make sure that that rate matches the rate that's in her prescription. If not, I would have to adjust the drip rate by using the roller clamp until I counted the correct amount of drops per minute. So now I'm going to let her infusion or her feeding administer. And once it's all finished, I want to close my tubing clamp, come over to the patient, assess the patient, make sure that no complications have occurred. Do you feel any nausea, cramping?
No,
or
I feel great.
vomiting? Okay, so now I'm going to disconnect this. And this tubing can be discarded. And then I would get my plunger from before and connect it to her tubing. Distal end of her tubing? Proximal end? Proximal end. Get 50 to 100 milliliters of tap water and flush it to get rid of any residual feeding that's in the tube, which could cause bacteria to grow and just gets crusty and nasty, so you want to make sure to flush that out. And then I can take my plunger off. I want to make sure to keep her head elevated still for the next 30 minutes at least to prevent any nausea, vomiting, cramps. I want to promote the digestion of the feeding. And again, I can provide mouth care before I leave the patient. So I can do that either by using the little sponges with the sticks on it that you dip in water just to wet the mouth, or I can provide total mouth care if able to. I couldn't find a little sponge for this purpose, but I do know how to use it. Now, after my mouth care, I want to make sure the patient has her call bell in reach and her belongings in reach. Do you need anything before I go?
No, thank you.
Okay. Then I will see you during my rounds.
Okay.